Good day, this is Mike Roth, President of Senior Insurance Marketing. Today I'd like to give you some tips on selling Medicare supplements and also giving you some ideas on how Medicare works as far as the Part A and Part B. First tip is always use the Medicare guidebook. It has all the information, the do's and don'ts, and we can send this guidebook to you. Just give us a call on our toll-free number, or we can send you an email link with this. The second thing I'd like to talk about is the Part A and Part B. When I'm in with a client selling a Medicare supplement, those are the first two things we talk about. And when you're using a Medicare guidebook, it can be long and very confusing to a client. So what I like to do is use a piece of scratch paper and describe how the Part A and Part B work. For starters, the Part A hospitalization. Very simply, Betty, the Part A covers all of your room and board except for the deductible. And that deductible today, in 2012, is $1,156. That's the first portion that a person's responsible to pay in days 1 through 60. Okay, and we'll show you how a Medicare supplement can work to help take care of this. The Part B is a little bit more involved. The Part B has a deductible, and that deductible is $140. That's a once per year deductible that they'll see on the "this is not a bill" statements that they get from Medicare. On those statements, it tells them at the beginning of the year how much of that deductible they've met. Once they've met that deductible, I want to use an example to show you how Medicare works. Whether it's a surgery or a doctor's office visit, Medicare works generally in this way. I'm going to use an example of a $16,100 surgery. When Medicare gets this bill, they decide first if they're going to approve on it. Okay, once Medicare approves on that bill, Medicare will approve a certain amount. We've guessed that Medicare will approve around $14,000. This is not provided by Medicare, this example. It's something that we've created to just show basically how that they work. $14,000 Medicare approves. So it looks like there's $2,100 left over for the client to pay, but that's not true, because Medicare only pays 80% of that $14,000. 80% of $14,000 is $11,200. Now, when you subtract what Medicare pays from the real bill, $16,100, that leaves you the amount that a person is responsible for, and that's $4,900. Everybody above age 65 is responsible for this bill in the same way. What we want to show you now is how a Medicare supplement is designed to help take care of these leftover bills. Now, I've been helping people with Medicare supplements for going on 16 years, and the most popular is the Plan F. A chart in the Medicare guidebook. This is a chart from the Medicare guidebook. And what it shows is all the different types of Medigap plans that you can purchase. The most popular is the Plan F. That's what we see. And what we like doing at this point is showing a customer or a client how that their Plan F works on taking care of these leftover bills. For starters, the Part A deductible. The Plan F will cover that Part A deductible in the first 60 days so that they don't have to worry about paying anything out of pocket. The Part B medical, $140. Medicare supplement, Part B deductible, will pay that $140 so that they don't have to. But the biggest portion of the $4,900, that's what scares the most people. The Medicare supplement Plan F, under the Medicare Part B coinsurance and copays and the Medicare Part B excess charges, those combined will cover that $4,900 so that they will have zero left to pay. By far one of the most popular plans, because it does take care of all remaining leftover amounts when Medicare approves. I hope you learned something today, and if you do need one of the Medicare guidebooks, please just give us a call or send us an email and we'll get it over to you. Thank you for your business.